Good afternoon, everyone. Welcome to the City of Alameda Mayor's Town Hall. I'm Sarah Henry, the city's Public Information Officer. Today, we're honored to be joined by four wonderful guests to talk about COVID-19 and what we can do to keep moving forward. Joining us today are Dr. Nicholas Moss, Alameda County Public Health Officer, Dr. Peter Chin-Hung, UCSF Infectious Disease Specialist, Cindy Call, owner of Spicy Comer, and Amy Wooldridge, Director of Alameda Recreation and Parks Department. Please note that all participants have been muted. To submit a question for the mayor or for any of our guests, please use the chat feature. All of our town halls are recorded and are available on the city's website and also on our YouTube channel. We've also turned on, or will in a second, the auto-generated captions. I'd now like to turn today's town hall over to Mayor Marilyn Ezzy Ashcraft.
Thank you, Sarah, and thank you everyone for joining us today. We have a really important topic and a great lineup of speakers that we're going to get to in just a minute. As you all know, we are moving into the orange, we are in the orange tier in Alameda County. In fact, I think most of the state has moved into this less restrictive tier, which means that businesses can open more fully. Some indoor dining is allowed at reduced percentages. Movie theaters, gyms, retail, they're all more fully open than we've seen during this pandemic. But at the same time, if you follow the news, you know that there are parts of the country, Michigan is one state, that is seeing another surge. And we don't want to do that here. We don't want to see that here because our residents, our school children, our businesses have really been impacted by this. We've all been impacted in one way or another, but some harder than others by the pandemic. So we have these medical experts with us who are going to talk about some concerns, some things you should keep in mind, how to open up, but do so carefully. And then I also have invited our Recreation Parks Director, Amy Wooldridge, to tell us a little bit about how our Recreation Parks Department is approaching these new relaxed restrictions with caution and yet with the understanding that our kids need to get out and have a good time and play and be in camps and whatnot. So we'll learn more about that from Amy. And then we invited Cindy Call. She's one of the owners of Spice and Comer restaurant here in Alameda, and also the president of Downtown Alameda Business Association this year. And she's going to talk about, from her perspective, what it looks like from the business perspective. So with that, Dr. Nicholas Moss, I'd like to bring you up first. Dr. Moss is our Alameda County Public Health Officer. He had been in the Alameda County Public Health Department for some time, specializing in the HIV department prevention. He was the director of Public Health Department's HIV and Sexually Transmitted Disease Unit. He has his undergraduate degree from UC Berkeley and his Doctor of Medicine from UC Irvine. He then trained in internal medicine, infectious diseases, and public health at the University of Washington, Seattle. And he has been shepherding us through this COVID-19 pandemic for, Dr. Moss, you'll have to tell us what month you started. After our previous public health officer, Dr. Erica Pond, was tapped by the governor to become, she's now our state epidemiologist. But Dr. Moss, welcome to you, and tell us how Alameda County is going to stay healthy as we move into the orange tier and beyond. Thanks so much for joining us.
Thanks, Mayor Ashcraft. Thanks for the introduction. I'm glad to be back in this forum. I think that, we're happy to be at a place still where we're able to reopen gradually in the state's blueprint. I know that a lot has been made of looking beyond the blueprint once we hit summertime, but we're not quite there yet. And we still have a lot of these restrictions in place, even after they go away. Face coverings, some of the employer restrictions that are, regulated by Cal OSHA, things like that. A lot of safety stuff is going to stay with us. But nevertheless, we're still in restriction mode, albeit lighter. So a couple things to keep in mind. Certainly, COVID is not over. And as the mayor was alluding to, there are parts of the country that are seeing rising case rates. There are parts of the world that have rising, very high case rates. We are not seeing that yet locally or really even across the state. Things have remained relatively stable. So that's good. But we know from the past that when you look around the world, often with COVID, you're kind of getting a peek into the future. And so I am concerned that we could see rising case rates here again. And because of that, we really want our residents and our businesses to keep doing all those things that we know work, even as we reopen. Stick with the face coverings, really limit your gatherings as much as possible. And those kinds of things will continue to keep our communities safe as we get more and more people vaccinated. And it may be, we're in a race, and it may be that we get to a place where we don't see the kinds of impacts that are being seen elsewhere with these cases. That's what we're hoping, but it's a little early to say. Oh, Mayor, I can't hear you.
No, it's my
There we
fault. I'm sorry. I didn't make the mayor the co-host, just all of you. I'm sorry. You are
I'm
the host
just
with the most.
I'm just the mayor. I'm not the co-host, but now I am. Okay, so thank you for that, Dr. Moss. And you mentioned the importance of vaccine and the race that we're in. I have been saying since the beginning of this pandemic that I thought time and science could be on our side if we just held out doing all those things we're supposed to do to protect ourselves from COVID as we waited for vaccines to be developed, and they were developed quite quickly. And I just want to give a little shout out to a community effort I'm very proud of. I was concerned about in Alameda that some of our seniors were not being able to get their vaccines scheduled because of the digital divide. They don't all have computers. Even if they do, it can be pretty nerve-wracking to try to navigate some of those websites and refresh, and all the things you have to do. So I started a mayor's COVID-19 vaccine task force. We sent out these huge postcards, more like a poster to households with a member 65 and older, and said, if you need help scheduling your vaccine, call this number. And we've got a great task force of a dozen folks, and then we've got some additional volunteers. So we've been scheduling people for their vaccines. And then we got the good news from the county. They reached out to our senior center director and said, would you like a vaccine clinic to come to the to come to the senior center on a Saturday in April? Is that even a question? And of course she said yes. And so April 17th, we've got a COVID-19 vaccine clinic. And so then we put the word out, because a lot of seniors don't want to leave Alameda to get their vaccines. So anyway, I am proud to tell you that we have scheduled more than 200 vaccine appointments. So this task force, and I can see, because I get the emails showing the voice messages coming in, that the phone is still ringing off the hook. Our city's amazing IT department developed a phone app for our volunteers so they can take the calls, return the calls from their cell phones, and it looks like it's coming from a city number, and we have multiple language ability. It's pretty slick. But Dr. Chin Hong, I want to go next to you, and we are so honored to have you join us today. Both of these doctors have been extremely busy, especially in this past year, and so thank you so much for taking the time to join us. I was reading news stories one morning a week or two ago, and I read an article about COVID-19, the importance of getting vaccinated, and there was this quote from Dr. Peter Chin Hong that COVID-19 is a shapeshifter of disease, and that's why it's so important to get vaccinated. And so I told Sarah, who helps pull these town halls together, I would love to have him as a guest on my town hall. So I'm honored to have you. Let me just tell you a little bit about our next guest. He comes all the way from Trinidad and Tobago, where he was born and grew up, and then did quite a geographical shift. And when he came to go to university at Brown University in Rhode Island, right? And did both his undergraduate and medical degrees from Brown. And then he completed a residency in internal medicine and a fellowship in infectious diseases at UCSF. Today, Dr. Chin Hong is a professor at UCSF and also works with UCSF's infectious disease clinic and more. And he's also quite a serious photographer. So Dr. Chin Hong, let me turn the Zoom over to you, and please share with us what should we know about vaccines, protecting ourselves from COVID, and whatever else you can share. Welcome.
Great, thank you so much for having me on, Marlon, Sarah, and everyone, and great to have you all listening to what I have to say. So I guess to speak about the virus as a shapeshifter, one of my sort of like 30,000 foot comments is that I'm so humbled by this virus every single day. I thought we'd be over with it by now. As Marilyn had said, I thought the science would prevail and it would be a thing of the past, certainly by this time. But it continues to evolve. It continues to humble us. We have to respect this virus. And I think the events of what's going on now, even in the face of vaccination, what's happening in Michigan, Minnesota, some of the other Midwest states, the uptick in the East Coast, a little bit in Miami in particular, and the fires around the world that is still raging, particularly in Europe, South America, Brazil, et cetera, really continues to shock me, honestly, because, you know, with all the science brain power at this point, we still haven't been able to really, you know, suppress this virus. So what I'm going to talk about in the next few minutes is why I'm humbled. And what we know about in the recent last few months is that there've been the rise of the variants. So the variants make this time very different from April of 2020. And the reason why is because they're easier to transmit for the most part. And some of them may not make our vaccines not as useful and may evade vaccine efficacy. And I'll get to that in a second. So there's the regular COVID, and what happens with COVID is that every time it makes a copy of itself, it's not precise enough, so it makes a few errors. And every time, so people think that it's making a mutation at least on average once every 2 weeks. Over time, we call it the virus getting smarter. It's not really getting smarter, but there's this phenomenon called convergent evolution, like in Darwin's finches, where certain superpowers for the virus get pronounced the more you go on. So the superpowers that are getting pronounced in each of these mutations being made by the virus is increased transmissibility and potential evasion of vaccines or immune therapies, and potentially causing more severe disease. So the way I think about the variants is in 3 categories. There's the good, the bad, and the ugly. The good is not really good, but in comparison to the other 2 categories, it's better. It's the regular COVID, which we've known well for the first 9 months or so of the pandemic. Then the bad is one main superpower, which is increased transmissibility. And of those, the most prominent is the UK variant, or the variant first described in UK, B117. That's the dominant variant right now in the US. It's kind of the most agile, it's the most powerful, it's the most bully-like, and it sort of takes over the environment wherever it goes, like it did in the UK, like it's doing in Europe, like it's doing in Michigan, Florida, California. It's kind of duking it out against our own California variant. So that's the bad, the UK variant, and the California variant, which acts a little bit like that, but the UK variant is much more transmissible. And when we say much more transmissible, you have your virus, and well, let's see if I can show this more. And basically, it's kind of sticking to your nose or mouth like sticky, crazy glue or Velcro, more than the regular virus. So if you're in an elevator with somebody in 2020 in April, you might have escaped it if they were unprotected and not wearing a mask. But in 2021, with a new variant, it's more likely to stick to you because it's like that bulldog sticking onto your nose or your mouth. So that's kind of like the bad. And the variant described in India, we called it the double mutant, whatever, in the press, that's in that bad category, potentially. And then there's the ugly category, and that's really both the superpower of more transmissible, you can catch it more easily, as well as potentially evading vaccines and immune therapy like antibody therapy. And that includes the Brazilian variant, P1 in particular, and the South African variant. It's not always true for all vaccines, but you know, luckily some of the Pfizer and so on have shown data that it's efficacious against some of these ugly variants, which is good, but that's not true all across the board. And at the end of the day, what I'm most worried about is not the ones we know about, like the California variant or the UK variant or the South African. It's the ones we don't know about yet, the ones that haven't been invented yet. Because again, every time there's a cycle of transmission and virus in the community, it's going to make a new variant, a new superpower. So you might have the Alameda variant in the future, or the Michigan variant, or the Detroit variant, and they may end up having more superpowers than the ones we know about. So it makes us really energized to go out and so kind of like be the henchman, be the force field to prevent virus from coming into our community as much as we can. And the biggest weapon we have right now is vaccinations, because these vaccines work against even this rambunctious crew of variants for the most part. So if we all go and get vaccinated when it's available, and I know people are frustrated because of shifting supply, but it is getting better. We're still on the track to have all vaccines available for anyone who wants it, you know, in May, certainly by June, for sure, even with production issues. We need to all go and get it now, because time is money, time is the essence. We can do something against it now. We can protect the vulnerable people in our community, because not everybody's going to respond to the vaccine, and we have to do it now. So those are my thoughts. Thank you.
Thank you so much, Dr. Chin Hong. You know, one of the things we're finding when we're calling to schedule, or when people are calling to schedule vaccine, and the clinic that I mentioned that's coming up a week from Saturday at our Mastic Senior Center, will have the Johnson & Johnson vaccine, which I'm really excited about, because for seniors and they have mobility issues, it's one and done. But we do find that some of the seniors, they're very particular. Not only do they not want to leave Alameda, but no, I don't want the Johnson & Johnson vaccine, or no, I only want the Johnson & Johnson vaccine, like when we could get them to the Coliseum or to the Pleasanton Fairgrounds or whatever. What would you say, and both of you, but let me start with Dr. Chin Hong, then go to Dr. Nicholas Moss. What would you say, what should we be telling our people who have these particular requests for their vaccine?
Honestly, Marilyn, I'd be psyched to get any vaccine. Really, I love all of them. Really, and that's a true and honest statement for me. They all have like little pros and cons, but overall, like, who wouldn't want that, any one of these vaccines? They're like amazing, and much better than, say, even the flu vaccine, which is the best that we have every year, which is about 40 to 60% effective. These are like way above. And the fact that none of any one of these vaccines prevent death, hospitalization, serious disease is like incredible. So, you know, just me, but I'm grateful to get any one of them.
Thank you for that. And I know I see some of our task force volunteers on the call on this Zoom. By the way, Sarah Henry has been a prolific call taker and scheduler. So just remember, that's they should be psyched to get any of them. How about you, Dr. Moss? Your thoughts, and then also, and I didn't prep you ahead of time, but if you have any additional or updated information about the Coliseum site, I know the county is working on taking over responsibility. What can you tell us about that?
So just very quick, I couldn't agree more with Dr. Chin Hong about the vaccine options. This is not a sales pitch. They're great options, all of them. And I agree, would be happy to get any of them. I think the data is really strong. And actually what we've seen is that there has been quite a bit of interest and uptake at the venues where we've been distributing Johnson & Johnson. So it does fortunately seem like a lot of our residents agree with that. So really fortunate to have all of these options. In terms of the Coliseum, so after a lot of discussions and planning, we are at a great place where we're going to be able to roll the site over from a state operated but with federal vaccine supply to a state operated but with local and state vaccine supply. So it's going to look quite a bit like it has for the past 2 months, but it'll be Alameda County, Contra Costa County, and the state Cal OES, Office of Emergency Services, all contributing vaccine, and it's still at a very high level, aiming for 40,000 or so doses a week, consistent with what it was doing before. And so we're really pleased to get to that place. And that's the plan is for the next 4 weeks. And that's great because a lot more people are becoming eligible. And so just very happy to be able to continue this option for people.
That sounds great. So when the federally supplied FEMA-run site stops their operation on April 11th, does it just seamlessly roll over on April 12th to the county part of it?
That's that's the idea. You know, it's a lot of the same staff working, Cal OES teams and teams they brought in, and so the idea is to keep it running right along, and we are I think just very fortunate that we were able to get that organized, and so. I think people should be able to schedule visits the same way that they were able previously, and should hum right along.
Okay, that sounds good. And do you know, will it continue to be the Johnson & Johnson vaccine?
I think it is. I would have to get back to you on that. I know that because Johnson & Johnson supplies decreased because there's this production issue. We don't expect that to be a long-term problem, but for a few weeks, that the supply may include some Pfizer vaccine, so people will need to come back for second doses. But I don't know the exact breakdown. I know we had some Johnson & Johnson vaccine still from the prior week, and so it'll probably be a mix, but exactly what that mix is, I'd have to get back to you.
But that's okay, because we know that any vaccine is great.
Yeah. To be honest, I think we're just glad to be able to have that site continuing to operate.
Absolutely. And I have heard nothing but positive reports about how well it ran and how well it is running and how quickly and efficiently people can get vaccinated. I know we've got some questions coming in from the audience. Sarah, do you want to let us know the questions? And then we will move on to our recreation director and our business person.
Sure, absolutely. So a couple of questions here. The first one is asking, how can we celebrate the rising vaccine rates while still stressing the message that we all need to wear our masks?
Who would like to take that?
Well, I can start, and maybe Dr. Chin Hong wants to jump in. I think it's a couple things. First of all, we're doing great with rising vaccine rates, but we have a long way to go. So about 50% of adults and adult residents in Alameda County have got some vaccine, but that means there's a lot of people who have not been vaccinated. There's a lot of people who haven't been eligible yet. We don't have an approved vaccine for people under age 16. And of those people who haven't been vaccinated, probably most of them, a lot of them have not had COVID yet. So they're still fully susceptible in a lot of cases. And so that means there's a lot of people who could get COVID You could pass it on. And also, these vaccines are terrific, but no vaccine, not for COVID, not for anything, is perfect. And there are going to be a few people for whom, even with the full series, that they might still get COVID. And so, we really want to do everything we can, especially at this early time. We're still concerned about the variants early in the vaccine rollout. We're still concerned about the variants, as Dr. Chin Hong mentioned. We really want to keep using those simple, relatively easy things that we can all do to keep each other safe and limit spread. And that means face coverings. In fact, those will probably be one of the last things that we step away from because they've been so helpful in limiting the spread. But also just some of those other common sense things that we've been asking residents to do all along.
Thank you. Next question, Sarah. Or Dr. Chin Hong, did you want to add to that?
Oh, no, I completely agree with Dr. Moss. And again, the more households you bring together that are unknown, you just don't know where that risk is. So in that outdoor setting, it's important to wear that face covering. In your intimate setting, the CDC guidance gives a lot of liberty in terms of vaccinating people in an intimate setting, getting together without masks. And if you go to a household who is unvaccinated, and they're low risk for getting bad COVID or sick COVID, you can still be with that person in unmasked setting. So again, celebrate the victories when we can, but when we go out into that unregulated, wild environment, be as protected as you can.
Thank you.
This next one came in while Dr. Chin Hong was talking earlier, asking how concerned should we be about the B117 transmission in children and the potential for expanded school reopening in the fall?
I think that's a great question, Sarah, and from the audience member. I think for right now, it's still, even though it's going down in age group, the main hospitalizations in the Midwest have mainly been in young adults. So they would be eligible to get the vaccine and not, I still think the kids under 12, even though there have been anecdotes of kids under 12 getting ill, it really hasn't panned out to be a huge number, statistically speaking, yet. I mean, that data is still being collected. In my heart of hearts, I still think kids are going to be protected relative to adults. They still need to be vaccinated at some point. And I think right now today, actually, the Pfizer's put in a request for a review of the data in adolescents, 12 to 15 years old. So I'm sure that group will be vaccinated soon, which is completely appropriate because that's the next group. But if you look at the numbers, even with variants, under 16, very, very low risk compared to older adults, even with variants. So sure, youth sports might be a little bit more extreme with, in the Midwest is mainly ice hockey. We think indoor, a lot of touching and noses and mouths coming together, so maybe not as generalizable to California. So my overall comment is still safe, particularly if you use those facial coverings, and all the other things that schools are putting into place to make that population safe.
Thank you. Here's another school question. I think this one's probably for Dr. Moss. Do you expect the physical distancing suggestions to drop to 3 feet as the CDC has recommended for schools?
You mean in other settings?
Yeah, perhaps. Yeah.
Or is that the desk spacing? Is that what
That's
the
how they've
CDC
recommended
guideline?
the desk spacing. But yeah, I think this is kind of saying in other settings, should we also reduce the 6 feet to the 3 feet?
So the 6 feet, they're not quite the same thing. So what we know from 3 feet is that in a classroom setting where face coverings are part of the safety measures, and it's very regulated. It's small groups, same, usually stable groups of kids, and just children. Really, that the risk of spread in that environment is pretty low, and several studies have shown that, including some real world experience from schools across the country and around the world. That's really different from many different settings with people of all ages, and so I don't think that we're ready to make that leap for other settings. And in fact, 3 foot, 6 foot, for adults who don't have masks on, if you're in an indoor setting, I don't think even the 6 foot, there's going to be some risk because you're in that indoor setting where virus could circulate. So I don't think we're ready to move away from that more general, rule of thumb that close contact is 6 feet, and that it really is just a rule of thumb. It's not nothing magic about that number, but it really I think is important for people to kind of keep that in mind for the time being. And even in kids, when somebody is sick and has COVID, that 3 feet rule with the desks, we would still consider a kid sitting at the next desk over to be exposed. So we'd still apply that 6 foot close contact definition, even in the classroom. I know it's a bit nuanced. I hope that was clear, but hopefully someday it'll be back to normal. But for now, close contact is still within 6 feet.
That's great. Thank you,
Thanks.
Dr. Moss. Here's another question for you. This person says that there seems to be a small uptick in Alameda County COVID cases. With the nicer weather, do you expect our case rate to continue to increase?
Yeah, I have been just poring over those numbers. I look closely at them. I'm like refreshing I look at our dashboard and I want to see as soon as it gets updated. So I'm not actually, I was pretty worried about that. We had one day with a lot of cases last week. Actually, a third of those cases were, according to the state contacted us and said a third of those were leftover late reports from a lab that was having reporting problems. So we left it up on the dashboard because that's the way our dashboard works. But that spike is not actually as bad as it looks. And actually, over the course of this week, we kind of flattened out again at where we were. 60, 70, maybe 80 cases reported a day. So I think we're still pretty flat here locally and around the region. Doesn't mean it won't happen, but for the time being, holding steady.
Great, thank you. Should I keep going, or if
well,
we have a
I
few
think
more?
maybe a couple more, and then we do want to jump over to our recreation parks and business representatives.
Absolutely. Here's another question for the two doctors. And sorry about I think there's a fire engine in the background. This person's question is related to the orange tier and returning to school. In the red tier, our elementary school students were tested every 2 weeks. However, later this month, all upper grades are returning to school and COVID tested is no longer required in the orange tier. With the 200% increase in COVID rates in younger unvaccinated population, this person is concerned. Can you provide additional information on why no COVID testing is necessary with all the schools now reopening in person?
So I'm not certain what was meant by the 200% increase, but just speaking generally, so that's the state's guidance for testing, and at lower community transmission rates, like where we are now in the orange tier, they really only recommend testing for symptomatic or exposed children. And again, it's a recommendation. Schools have some flexibility in terms of how they apply that. And so I think that's reasonable. We really do want to test people who are exposed or who are sick. When case rates in the community drop pretty low, you start to run into more false positives than true positives with, our tests are good, but they're not perfect. You start disrupting classrooms unnecessarily. So I think it's appropriate to have a more selective approach when we're at relatively lower community transmission. And then I think what the question will be what things look like as, if rates do go up, or in the fall where a lot of kids still haven't been vaccinated, but most of the rest of the folks are, but that's still a ways off. So, we'll see.
Thank you. And just to clarify, this person had read that the 200% increase was in the Midwest in kids. Specifically, they were referring to Michigan, where there were links to schools and reopening and kids sports, which you mentioned before. Thank you for that. Another question for the doctors and maybe for Dr. Chin Hong, how soon will we know if the existing 3 vaccines really protect us from the known variants?
So we already have some data that they protect us against the variants. Turns out that J&J did their trials in the face of all variants because they did it a little bit later. So we do know that they work against the South African variant, which is again in my ugly category. We know that they work well against the California variant and the UK variant because those were very common at the time when the study was being done. Coming to, so that's J&J. With Pfizer and Moderna, their lab studies showing that they work against the variants. And then Pfizer last week issued 6-month data of the efficacy of their virus, showing pretty much like 100% efficacy in the South African variant, which was shocking to me. I was surprised and delighted by that. AstraZeneca is not the same. It's not performed well in South Africa. So I guess with variants, there's a little bit more differences, but all the ones that we have available right now that's under emergency use authorization by the FDA, I'm very confident in them. And again, I'm worried not about these variants, but about future ones that will be invented if we take longer to control the virus. And again, the vaccine is like such a key way for us to put up our force shields.
Thank you. Let's move over to hearing from Amy Wooldridge first, and then Cindy Call to tell us a bit about. Welcome, both of you. Amy, tell us what Recreation Parks Department has in store for our youth. And I know actually the Recreation Parks Department has been doing things all along, but now that we move into the summer season, just tell us what's happening.
Absolutely. Thank you, Mayor. Yes, and parks continue to be incredibly important for everyone in our community, and the mental, physical health of folks and the connection with community. And I want folks to know that both in our programs and our parks, we're still continuing to follow all state and county safety precautions and guidelines. But now that we're in the orange tier, it has opened up a bit. And what we are offering new to the public, as you mentioned, we've been offering after school and summer programs since last summer. But now we're also offering picnic rentals as of last week are now available and open to the public, and you can rent those online, reserve those online. And our fields are pretty full, are quite full now with youth playing sports. There's high school sports. They're getting all of the seasons, the whole year of seasons of sports in this winter and spring. And all of our, at this point, all of our local nonprofit youth sports organizations are out there playing. They do follow also all COVID guidelines and work with us on that. All of our outdoor public basketball courts are now open. Really want to encourage, as is everywhere, as was said, outside, you should be wearing your masks. I know it's harder sometimes when you're playing a high intensity basketball game, but we really need people out there to be wearing masks and really playing with their households when they're playing basketball. The Alameda Point gym rentals are also available now at a limited capacity. So we're getting people out playing basketball and volleyball now. In addition, adult sports is starting to open up. We're offering a pickleball tournament in April 23rd and 24th, as well as starting registration for adult softball league. They'll be starting later this spring. Indoor rentals are still very limited at the Oak Club and our recreation centers. They are available if they're religious ceremonies, but people can contact us to talk that through more. We're also continuing to offer outdoor classes, and we're now expanding with some of our Mastic Senior Center outdoor classes, such as line dance and hula dance, with more to come, and providing still tons of online classes for Mastic and youth and adults, as we've been doing since last spring. The guidelines for the number of youth allowed in each what we call a cohort for after school and summer camps has been lifted by the state and the county. So Recreation Parks Department, we are going back to our 10 youth to 1 adult ratio. So that's opened up a little bit of space. We were 14 per group. And so now we have a little more space for our spring camp next week and for our summer camps and our after school programs. So we did have a lot of wait lists because we had to keep them so small, but we will still be keeping our groups at no more than 20 kids per group and per site. So we'll still be keeping them separated and implementing a lot of safety protocols. We also are still hiring for recreation leaders. So if you know anyone who's motivated and interested and likes working with kids, please send them our way. You can find all the information on our website. In addition, we have some groups that have this whole year plus only been meeting online and starting to meet in person, like our Alameda Youth Committee, which is a youth leadership development group, and Friends Connect, which is a social group for teenagers with developmental disabilities. Lastly, I want to mention community events. I know that's something that people are really looking forward to and really interested in. We're being very cautious as we're moving forward. There are some current state guidelines around that. So coming up, we have Earth Day 2021. We have a virtual website at earthdayalameda.org with a ton of activities and information. So please check that out. We also just, I think yesterday, opened up registration for up to 20 people to do a tree planting event at Cruzy Park. So that's available as well for Earth Day. We will be bringing back this summer our Starlight Movies in the park. There's 3 outdoor movies. They'll look a little bit different in that they will be reserved seating only with no drop-in. And so we'll be chalking out circles and where households can sit. And so it'll look a little bit different, but in terms of how you sign up and get there, but once you're there, it'll be just as great as it always was. For the 4th of July, sadly, we will not be having the 4th of July parade this year. We hope to bring it back in 2022, depending on how things go. So this year, we're still working on developing several events. One, though, that's confirmed, we're calling it the Porch of July, and it's a celebration for the 4th of July and encouraging people to decorate their homes, their porches, their cars, their bikes, their walkways. And we'll be collaborating with artists and providing some financial support as well. And some more activities will be forthcoming for 4th of July. And then lastly, we'll be having, again, our annual swim. We will be hosting our 67th annual swim championships in August and our tennis championships. I think we're at the 103rd tennis championships later this summer. So that's it. Open to any questions.
That's quite a lineup. Thanks, Amy. Let's go to Cindy Call next, and then we might group the questions a bit. So Cindy, you have had quite a year, and I have to say, once a week on Tuesdays, there's the Tuesdays at 2 business town hall with our community development, economic development, and then business owners and our business associations. And I have to hand it to you, Cindy. You have always been so upbeat and positive. Definitely a glass half full kind of person, which I really appreciated. And I know you're participating in our Feed Alameda program, but now, of course, their lovely German restaurant is fortunate to have an outdoor patio, and you've been open for outdoor seating. But what's it looking like now? What would you like customers and patrons to do? How can they help support your business, but still help keep you and your staff safe when they come back to dine in person? And welcome.
I think that, well, at this point, we want to do what's going to make our customers feel safe and also protect our staff. The staff is almost fully vaccinated. I think we only have a couple more people that haven't had their second shot. And, we just have to keep doing what we were doing before and reminding people to wear their masks and things like that. What customers can do is, they can let us know what they prefer. If they don't feel safe going inside, they can sit outside. And if they sit outside, don't complain if it's cold, and dress appropriately, things like that makes it a little easier on staff.
Tell them they're not in New York City or Minnesota, for crying out loud. It's Alameda, but no, I know it gets a little damp in the evening.
We've had to buy a lot of propane over the last months. But I think moving forward, I don't see a lot of big changes of what we're going to do operationally. We'll keep the beer garden spaced out, and then inside, I don't think we're going to try to put more tables in than we already have, because I don't think people are really quite ready for that yet. I think we'll let them dictate when they are ready. And ventilation, I think, is a good thing to have. We'll have the windows and doors open as we've been doing, and I think that'll help keep everybody safe and also make them feel safe. I think it's different for smaller restaurants. They may not have the same options as I do, but I think ventilation is something that they can do, and maybe the plexiglass in between the tables. And there'll be a lot of changes, because I don't think people are going to really change their behavior too much or want us to change too much, too quickly.
Yeah, thank you for that. And I think it is so important for people to remember, if you are going to dine, whether you're outdoors on the patio or indoors at reduced capacity, you still have to keep your mask on unless you are eating or drinking. So while you're just, waiting for your meal to come or waiting for the check at the end, mask on, you can have a conversation from behind a mask, just talk a little louder. And I know I've heard it said by restaurant owners that it puts staff in an awkward position because they're relying on tips from their customers. And so they don't want to be nagging their customers at the same time. So don't make them do what you're supposed to be doing. But thank you for sharing that.
Those stickers too that the city made on the tables that say that, when to keep your mask on, when to take it off. And, we'll continue doing that and politely reminding guests when they forget.
Thank you. And do either of our doctors want to comment at all on dining options and things we should keep in mind, or did we cover it all?
Well, I would just add, and this was kind of being forecast, but we're not quite there yet. But starting this summer, it's going to be a place of a lot more flexibility, but also responsibility at the individual level, at the level of businesses as well, to do things in a way that both work for them and their customers, but also that to limit COVID spread. And we're really moving on from these kind of sets of hard and fast legal restrictions, and we, people will continue to have guidance about the way to do things safely, but it's going to be a lot more. Do I feel safe? Do I feel safe now going to these settings or those settings? And are there too many people in the restaurant? And it's really going to be that kind of world, I think, for a while, much more so than these top-down legal restrictions that we've had.
Yeah. Okay. Sarah, do we have more questions?
Yeah, a few more. This question came up before Amy started talking about cohorts, but it's related. Somebody said at the last school board meeting, it was said that the staggered start and dismissal times were required for cohort stability. This person asks if that really is the case, and they say that wouldn't the brief contact with other students in hallways not affect the cohort stability?
That's about schools though, right?
Right. For similar cohorts, but I think it's a question for Dr. Moss.
Oh, okay. Dr. Moss. Yeah,
and I full disclosure, I sort of only caught part of that before I realized it was going to be.
Yeah.
This is. I think that I'm going to answer broadly, which is that the school's guidance is got more flexible over time. Because we want to be able to avoid further barriers to getting students back in the classroom, because it's going to be so important for them to be back at school, and we know that things can be done safely. So yes, there are some things in the guidelines that are the overall goal is to keep things small, to try to separate groups of students as much as possible. There are going to have to be things that are adjusted at the individual school or district level, especially as we move past some of these more stringent restrictions, to try to make it work. And so it may be that for a given school, there's going to be a better way to do it than that type of staggered cohort approach. But it really is going to vary quite a bit from institution to institution.
Great, thank you. I have a question, and I think I'll pose this to Dr. Chin Hong, if I may. What could you tell us about travel and traveling safely? Where, here in Alameda, our schools are about to go on spring break next week, but then certainly summer is coming up just around the corner. What advice, what guidelines would you have for people around travel?
Yeah, so I'll have a few travel pearls. My overall pearl is you look at your destination, not just for the weather, but for the COVID weather. So for example, it may be a little bit more risky going to Michigan right now for and look for alternatives. We have so many alternatives close by. The second pearl is, although the CDC has sort of made more free statements around people who are vaccinated traveling, if you travel outside the US, and it's very restricted right now to go internationally, when you come back to the US, you require a test to come back in. So even though it may be easier to go to, say, like Mexico, which has no restrictions for US travelers right now, when you come back to the US, you'd need to have a test. So to coordinate all of that stuff may be more difficult. So I think sometimes, at least for the next summer, taking advantage of all these amazing local destinations might be less complicated. So if you do travel, think about the places where a lot of noses and mouths are coming together. So the trip to the airport, TSA lining up, the trip from the airport to the destination. The airline itself is probably going to be safe, but keep your mask on if you're not eating. Definitely when you go to the bathroom. Sitting maybe at the window is a little bit less risky than in the corridor and the aisle because of noses and mouths passing by. But again, the airline is generally a relatively good, decent place to be with good ventilation. So not to worry about that is really in these other touch points.
Great tips, Dr. Moss, Dr. Chin-Hong, your pearls are pearls of wisdom. So on the testing for international travelers coming back, returning to the US, will the tests be available in the airport for international travelers? Because, I mean, we wouldn't want them, well, I don't know. How does that work?
I think it's very variable and depends on the country you're going to. That's why I think it's very dicey right now, but some airlines are helping travelers do this testing, but at a cost. For example, I think United, America, and some of these others may help passengers get that test to come back into the country. So talk to the airlines, make sure you can get it done in time. Some countries, again, are not completely off, completely restricted right now to Americans, like many places that people think about, like Europe, France, Spain, etc. The UK may open up over time, but right now it's relatively closed.
So this is a test that you are required to have actually before you enter
back into the US, even if you're vaccinated.
I see. Okay, good information. Thank you. Let's see. Do we have time for? We've got 2 minutes. A couple quick questions, Sarah.
We have 2 questions. Let's see if we can do them. I think they're both actually for you, Mayor. If for other folks, if they can chime in. This person says, "Great for the senior vaccination for the city of Alameda. How are we doing for our unhoused and for our less mobile residents?"
Oh, good question. Thank you. I am really humbled by the effort that has been made. So for our unhoused population, our homeless, we have had a number of mobile clinics that have come out to the day center that we have at Alameda Point Collaborative, not at Alameda Point Collaborative, at Alameda Point. And for the doctors, that's our former Naval Air Station, and a wonderful nonprofit called Village of Love administers that, and with all COVID safety precautions. But they have had at least one, if not a couple, of mobile vaccine clinics that have come out there. We also know that Operation Dignity, which works with homeless veterans and formerly homeless veterans, they have worked with the VA to bring vaccines out to the folks who live in Operation Dignity housing on Alameda Point, and also in our new affordable housing for seniors, low-income seniors at Alameda Point, some of whom are formerly homeless veterans. And let's see, what's the other thing we're doing? For people with mobility issues, we also are able to provide transportation to our Mastic site. And when our volunteers were scheduling people before we knew we had the local site, they would work with them to see, do you have a family member, a neighbor, a friend, someone who could take you? If not, if they were registered with the East Bay Paratransit, they would help them schedule their ride that way. One of our task force members is the executive director of Center for Independent Living. And so he's also informed us that the campus in Berkeley has made vaccines available and transportation to get folks there. But we're also partnering with him to make sure that any of his folks with disabilities who need to have housing, have their vaccine in Alameda can come to Mastic on the 17th. And then this is still in the works, but I think we might get to be part of a pilot program for in-home vaccinations for homebound individuals. But I should also add that our housing authority, which runs 3 different apartment complexes for low-income seniors and, with Section 8 vouchers and whatnot, they have partnered with pharmacies to for the pharmacists to come in and give the vaccines there. And all of our assisted living, senior care facilities in Alameda, everybody's vaccinated, staff and patients. So we're working on it.
Thank you, Mayor. Next question, last question for you, and I think also for Cindy. What is the city and local businesses doing to ensure that essential workers, especially workers from the Latinx community, have easy access to the vaccine if they want it? And will there be similar clinics like the one at Mastic for essential workers in the city of Alameda?
Well, and essential workers, if you work in the food industry, whether it's restaurants or grocery stores or agriculture, food service, have been eligible for a while. We were focused on our seniors, so I'm hoping that people were able to get their vaccinations at the sites that were listed. But if they were not and still aren't vaccinated, and I know they made a real push at the Oakland Coliseum, and I know from talking to local restaurant owners, a lot of their folks did that. And we had some really creative thinkers like Tucker's Ice Cream that got their folks appointments on different days, because you really don't want everybody having that second vaccine and then the side effects at the same time. So I know, and Safeway, we know that Safeway workers were getting their vaccinations through Safeway's pharmacies. But if there are people who still haven't been able to get their vaccines, we're hoping that if we fill all our slots at the April 17th clinic at Mastic, they will do another one. And we've already opened that clinic, by the way, to 50 and older. So if you happen to be an agriculture worker, you're 50 and older, Sarah, do we still have slots open on the 17th, if you know?
We do. We definitely have slots open. I put the number in the chat, but it's 510-747-7512. Please call. We will help you.
Yeah, and call right away, though, because they are filling up fast. But we have the opportunity, I'm told, to get another clinic on the 24th. So we'll definitely get the word out. And if all you have to do is call this number, and as I said, we have amazing volunteers standing by to help get you registered. Okay. Well, with that, I just want to give such a big thank you to our guests, Dr. Chen Hong from UCSF, Dr. Nicholas Moss, Alameda County Public Health Officer, Cindy Call, local business owner and president of Downtown Alameda Business Association, Amy Wooldridge, our amazing Recreation and Parks Director. Thank you for sharing this great information, this knowledge, helping keep us safe. And we are so grateful for your time and sharing this important knowledge with us. So thank you so much. We will follow your advice. All right. Thanks for joining us, everyone. Take care, stay safe, wear your masks.
Bye.
Bye now.
Bye, everyone.